Well, tonight, Fox 59 is taking a deeper look at how IMPD responds to mental health calls and how the city hopes to expand those resources. Yesterday, IMPD released video showing the in-custody death of a 39-year-old man, Herman Whitfield III.
The release of the video has several community leaders urging city officials to expand the current Mobile Crisis Assessment Team, also known as MCAT. They also want to have a new team, a clinician-led response team as well. Fox 59's Bianca Reyes joins us now live in the newsroom. She's sharing where those efforts stand this evening.
Yeah, Birchelle, right now the city's Mobile Crisis Assessment Team, or MCAT as you explained, consists of 9 teams that are made up of 1 IMPD officer and 1 mental health clinician with Eskenazi Hospital. Now, IMPD Chief Randall Taylor says he's willing to expand that program, but staffing on the clinician side of things proves to be the biggest hurdle.
People who need help don't need handcuffs.
Following the in-custody death of 39-year-old Herman Whitfield III, faith leaders across Indiana are calling for reform.
I think this situation speaks volumes to the necessity of having a clinician-based team working alongside IMPD.
Back on April 25th, Whitfield's parents called 911 asking for help with their son.
Yes, I need someone to come. My son is having some sort of episode.
The call came in around 3:20 that morning, well past when IMPD's Mobile Crisis Assessment Team would usually respond.
Typically, they're working from 7:30 to about 6 in the evening, Monday through Friday.
The city's Mobile Crisis Assessment Team is often referred to as the MCAT program. Both an IMPD officer and an Eskenazi clinician respond to mental health related calls together through this partnership. But the program only consists of 9 teams and it's not available 24/7.
We can provide the officer, but you have to have a clinician as well. So,
in an interview with IMPD Chief Randall Taylor on Tuesday, he said hiring more clinicians continues to be a hurdle in expanding the MCAT program.
if some of those people can be found that are willing to do that, then we'd certainly entertain that idea.
Care, not cuffs. Thank you.
Leaders with faith in Indiana have been vocal about bringing something new to the table.
We must do better.
They're now working with the city to bring a clinician-led response team to Indianapolis.
How we can hire people, what their salaries can be, what are the hours, because we want to make it 24 hours a day, 7 days a week. So we're trying to work through that right now.
It's a plan to expand and improve that already has the city's support. Now faith leaders say they will continue to push until pen hits the paper and boots hit the ground.
I love that it's been greenlit, but now we need it to be executed so that these kinds of things don't continue to happen.
Now, Mayor Joe Hogsett vowed to ask the City County Council to fund this clinician-led pilot program as early as the next budget in 2023. Reporting in the newsroom, I'm Bianca Reyes, Fox 59 News.
You can watch the video IMPD released on fox59.com. A reminder, it is not the full video, but what IMPD has edited and released in part. We also have the statement from the family and more info on the wrongful death lawsuit they have filed.